The World Health Organization announced that routine dental visits should be postponed in areas with high COVID-19 numbers, but some disagree. Amani Abraham has more on this story from dentists who say those visits are essential to health care.
Close contact for a prolonged period of time. It's something the World Health Organization noted when they recommended delaying routine dental appointments in areas with high COVID-19 transmission rates. But not everyone agrees.
It's the dentist, in my mind, the dentist's obligation to take the precautions and invest in their office to keep their patients, staff, and themselves, out of harm's way.
Local dentists are expressing their concerns, along with the American Dental Association. The group said they, quote, respectfully yet strongly disagree with WHO's recommendation, describing dentistry as essential health care.
There are a lot of oral manifestations of general diseases, diabetes, some cancers, some liver disease. There are all types of issues that often are caught by a dentist before it's caught by their physician.
Dentists we talked to say those routine visits can be important to someone's overall health.
You can go to the dentist, but your dentist needs to be fully equipped with different type of filtration systems that allow you to get in there and feel comfortable.
Strongsville dentist Dr. Chris Theodorou says he's brought in clean air technology and other items to protect his team and patients.
Each chair has a high vacuum HEPA filter with almost like a cone that goes in front of the patient's mouth. So when we do drill on the patient or we try and clean them, any aerosol created, it is being captured by that HEPA filter.
While the WHO recommended routine visits be postponed, they did note that people should still go to the dentist for urgent or emergency dental issues. Dentists recommend that patients do a little extra homework before making their next appointment. Call ahead to see what steps are in place to protect against COVID-19. Amani Abraham, 3 News.